listen to this. If the tick is engorged, right, like the tick is obviously swollen, it's possible that their germs might have gone into you, the victim, and then the tick is falsely negative. So
Oh.
patients have called, they're like, oh, I got a tick bite and the tick is negative. I'm like, oh boy, I'm officially scared. Whereas others would be, oh, I got a tick, I tested it for $300 and it has Ehrlichia and 2 strains of Lyme. I'm like, okay, there's a chance that the tick has the germ and it never got into you. So in highly endemic regions where we are, a negative tick doesn't necessarily mean you didn't get the infection.
Interesting.
Yeah.
And does it matter if the tick was pre-fed before it fed on you? Does that matter where the germs are residing in the tick? So,
yep. Typically, if the tick like is already fed, it's going to be laying in the grass all fat and happy. It's like not going for another meal until, and typically they feed 2 or 3 times in a lifespan. So typically those are like the really hungry ticks. And typically the germs live in the midgut, although there's one study that showed that they also live in the salivary gland. So those ticks that have fed for a long time, those germs, may stay in the tick if it's a short attachment or get transferred over to you if it's a longer attachment. The exception is the Powassan virus and alpha-gal have like a really fast transmission time, like 15 minutes.
15 minutes, right?
It's just amazing. Right. There's just so much to it.
Yeah. Ehrlichia too can be transferred quicker than the CDC's recommendation. So,
right.
Yeah, my son Michael, he got bit, and within
hours,
10 hours, he had the rash on his stomach, and he couldn't get up on the bed, and but living out here and trying to keep myself educated about it, I knew exactly what to do. I feel like I took the tick, I knew the signs to look for, and I think that's important too for people to know that yes, of course, don't get bit is the one way to do it, but then what do you do when you get bit? And there are ways to do it and calmly do it and figure out, because the worst thing is if you got bit and you didn't know you got bit and then you're sick for later and have no idea why. At least you can, follow this tick bite and look for symptoms.